Hello and welcome to Plasticity Centers educational seminar. Today we will be discussing the three legs of the concussion stool, which are mind, body, and brain. I am joined today by three top medical providers in their fields, Dr. Sean Kornfeld, a functional neurologist at Plasticity Centers, Dr. Tamara Pollock, one of the few neuro-acupuncturists in the Denver area, and by Dr. Beth Ballin, a psychiatrist and owner of the Ballin Medical and Wellness. So first, I wanted to start by opening up the floor to Dr. Kornfeld, if you wouldn't mind introducing yourself.
Hello, everybody. I'm Dr. Sean Kornfeld, as Angel said, and I'm basically the lead clinician here at Plasticity Centers of Colorado. I oversee and manage all of the evaluations and treatments here at our location. And for the most part, we're seeing a lot of individuals that have concussions and post-concussion syndrome as a result of the inability to recover from concussions. And with that, just wanted to say thanks a lot for having me, and thanks everybody else for being here as well.
Thank you, Dr. Kornfeld. And then Dr. Ballin, would you like to introduce yourself?
Sure. I'm Beth Ballin. I'm a physician. I've been practicing in Colorado for about 20 years. I do practice psychiatry, but have a functional medicine approach. I own Ballin Medical and Wellness and also the Colorado Recovery Infusion Center, and work alongside other functional providers and prescribers and therapists as well.
Thank you, Dr. Ballin. And Dr. Pollock, please introduce yourself.
Hello, my name is Dr. Tamara Pollock. I've been an acupuncturist and practicing in the Denver area for 25 years. Recently, in the last 5 years, I've undergone education at the Neuro-acupuncture Institute. And so I've added this modality to my practice. I also do functional medicine and lab work, and I'm a homeopath. And so I've experience in treating autoimmune diseases and other types of inflammatory diseases. And I'm happy to be here. Thank you.
Thank you so much. So to go into what we're going to be talking about today, just a brief description. So according to the CDC, a concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and the brain to move rapidly back and forth. This sudden movement can cause the brain to bounce around or twist in the skull, creating chemical changes in the brain, and sometimes stretching and damaging the brain cells. Medical providers may describe a concussion as a mild brain injury because concussions are usually not life-threatening. Even so, the effects of a concussion can be serious. There are many misconceptions about concussions and concussion recovery. Today, we are going to ask the experts about how the mind, body, and brain can react after a blow to the head. So to get started, I would like to ask each of you, what distinguishes your approach from other providers in your field? So Dr. Kornfeld, if you'd like to get started on that.
I think for a lot of conventional neurologists, when they look at the brain, they're really preoccupied and focused on the acute aspects following a head injury or a brain injury. So a lot of providers are more concerned with brain bleeds, structural changes in the brain, so like tumors and plaquing and different types of aspects of structure like that. For us, though, as functional neurologists, what we're really looking at is the function of the brain, or in other words, the connectivity in the brain, or how the brain is working and interacting with not only other parts of the brain, different regions, but also different body parts as well, like the eyes, or different parts of the body responsible for balance as well. So a big approach for us is not to look so much at the structure of the brain or how the brain looks on something like an MRI or a CT, but more so how is the brain working and controlling various parts of the body and working together to allow the person to function and have a high quality of life.
Thank you. And Dr. Ballin, how would you say, what distinguishes your approach from other providers in your field?
With traditional psychiatry, we're trained to treat symptoms. And if somebody comes in with depression or anxiety, we usually look towards medicines to treat those symptoms without questioning an underlying cause, with just calling it major depression or bipolar disorder, but not looking underneath for other things that can be causing those issues. And specifically with head injuries, most people don't come in to see a psychiatrist and say, I had a head injury. It's usually complaining of brain fog or memory issues, depression, mood lability. And then when we're taking a history, we hear about the head injury that they didn't think was really important at the time. So taking a functional medicine approach is very different because we are doing different testing. We're taking a more thorough history to look for other causes and hopefully picking up on concussions and things like that, that if we can treat the underlying issue, then somebody doesn't need to be on medicine for depression or anxiety, or perhaps their presenting symptom.
Absolutely. Thank you so much. And lastly, Dr. Pollack, what would you say as far as for your approach that kind of distinguishes you from other providers in the field?
Well, other providers of the field are typically practicing and using traditional Chinese medicine acupuncture. And this type of acupuncture was developed by the Chinese thousands of years ago, where they discovered that there's energy pathways in the body called meridians. And each meridian has an internal connection to each organ system. And it's been mapped out, there's acupuncture points along these meridians. And these points are stimulated with acupuncture needles. And traditional is called body acupuncture. Neuro-acupuncture was mainly developed in the early 70s by a Dr. Jason Howe. And this particular system combines traditional Chinese medicine acupuncture with Western neuroanatomy and neuroscience. And in this particular case, scalp acupuncture is used, and then the areas of the brain, according to Western neuroanatomy, are stimulated with acupuncture needles on the scalp points.
Wonderful. Thank you for that. Now, to go over to Dr. Kornfeld, can you explain what happens to the brain when someone has a concussion?
Yeah, so when somebody first has a concussion, we're first concerned with the actual physical trauma of the actual injury, which is why it's always very important to not only go to the emergency room, depending on the severity of the injury, but also to get imaging done. I think at least is to get imaging done right away, because we're really concerned in the acute phase about there being structural changes, kind of like what we talked about before. So when you have a concussion, let's say you hit your head here, and then we're concerned about there being a hematoma or a brain bleed that develops here. We're concerned about different processes, physical processes that could occur in this area due to the initial trauma. At the same time, when you have that injury, that physical blow is going to send shock waves or forces basically that go throughout the rest of the brain, which basically is like the consistency of Jell-O. So you would imagine if you flick a side of Jell-O, the whole thing kind of reverberates and vibrates as a result of that. So that's where you tend to see some of these symptoms that might not correlate with where the actual physical injury is, because you have this stretching and rotation that occurs throughout the brain. And just because of how these physical forces work, typically the central, the more middle and the more deeper structures of the brain are the ones that are really impacted by these torsional and stretching, shearing forces. That's going to be predominantly deeper parts of the brain, like the brainstem. And the brainstem is what holds your vestibular system, which is what's responsible for gravity, areas of the brain responsible for eye movements as well. So, you know, after that initial trauma, you have that vibration that kind of goes through, and then we're concerned about some of these stretching forces that have gone throughout the brain. And that's where a lot of people will end up developing post-concussion syndrome and things of that nature, because that initial trauma, physical trauma, has healed and everything's been looking okay. But those torsional forces, or those shearing forces, is really where a lot of that lasting dysfunction occurs, and where those lasting symptoms are caused by as well.
Great, thank you for that. Now, Dr. Ballin, Dr. Kornfeld just touched on what happens to the brain when someone has a concussion. Now, what are some of the mental effects that commonly are seen in patients that have sustained a concussion or a head injury?
People can present with a wide range of symptoms. Depression is probably number one. Depending on what happened, sometimes people develop PTSD or start to develop PTSD. Sometimes it's brain fog, memory issues, trouble with cognition, not feeling as sharp as they were. Occasionally personality changes, mood lability, but often it's a big change from somebody's baseline if they're coming to my office.
Yeah, thank you for that. For Dr. Pollack, I know you touched on this a bit much in your first question. Can you kind of dive deeper into the difference between neuroacupuncture from traditional acupuncture?
Neuro-acupuncture particularly is dealing with a brain injury or a concussion where there's been damage, as mentioned. In a concussion, there's acceleration, deacceleration of the brain and the area of impact. And so the symptoms are addressed typically with a brain injury. As mentioned, the patient can have memory loss. They can have issues with vision. They can have issues with balance. And so the areas that are damaged with the brain are addressed with scalp acupuncture. If the patient has vision issues, then the vision area, which is based on the neuro-western anatomy, as opposed to the meridian system. So that's where you combine Western medicine with Eastern medicine. And so typically neuroacupuncture is much more effective for treating brain injuries because it's treating the area of impact with scalp acupuncture. And then along with that, then body acupuncture, whether the injury is to the neck, shoulders, or other areas of the body, are also treated as well. So typically a combination of both scalp acupuncture and body acupuncture is used.
Great, thank you. Dr. Kornfeld, what are the main components that are affected in the brain when a concussion occurs?
I think, you know, every concussion is different. There's many different categories of concussion. But typically what we see here with a lot of the symptoms being more physiological, like dizziness, headache, difficulty reading, things of that nature, balance issues as well. We tend to really group them into three major sensory systems. We have our vision system, which is our eyes. We also have our vestibular system that I mentioned earlier, which is basically the ability to perceive gravity and know where you are in relation to everything else, in relation to the environment. So like depth perception, for example. And then we also have our proprioceptive system, which is our basically receptors within our joints of our limbs that tell us where our body is. So for example, your ability to raise your arm and know that your arm was raised, that has a lot to do with receptor feedback from these joints. So when we look at these systems that are impacted by concussion, those are really the three main ones that we focus on for a predominant population of our patients. And with that comes a lot of the testing that we do. So we do vision testing and then balance testing as well as sensory testing. So a lot of people will come in and they'll say, hey, my balance is pretty good. Why are we doing balance testing? And it's for that reason. It's because we're trying to see how all of those systems are working both individually and together in combination to allow the patient to better perceive the environment. So another way of putting that is your brain is basically, its main responsibility is to process sensory information coming in. And following a concussion, there's a lot of sensory mismatch. So the visual system's telling the brain something different than the vestibular system and then different than the proprioceptive system. And when that's the case, the brain really doesn't know what's going on in the body and where the body is in relation to everything else. And that's where it kind of gets put on high alert. And you start to see a lot of these symptoms like dysautonomia, POTS, a lot of these concussion-like symptoms that we're seeing.
Thank you. Now, Dr. Ballin, each of you have touched on a few different symptoms, and you kind of went through a few symptoms that you've seen from your patients that come to you. Can you touch on some of the things that are going on in the brain that may lead to these symptoms?
I would say number one is inflammation. And normally I say number two is inflammation, and number three is inflammation. Sometimes you have nerve damage, you have damage to cell signaling pathways. So neurons aren't getting the correct messages to each other. Sometimes you have decreased blood supply, depending on the injury. With inflammation is supposed to be a good thing. And if, let's say, we hit our arm, and you want to have inflammation, you want those signals to go out to pull certain hormones over to help heal. And when things can go awry with inflammation, and it can backfire, and a lot of times in the brain we see that.
Thank you. Dr. Pollack, now I know you talked a little bit about how you'll actually treat not only the head, but also include the body in your process. Can you walk me through, what does your evaluation entail when you're working with a concussion patient?
Yes, initially it's discussed where the area of injury is according to the brain. And then also I want to discuss what kind of symptoms that the patient is having, whether there's pain, whether there's dizziness, whether there's headaches, whether there's migraines. And then particular areas of the brain or scalp are selected according to those symptoms, as well as where the injury is. And then treatment as far as the body acupuncture, whether it's the neck, shoulders, or other injury is discussed. And then also a course of treatments, what that would typically look like. With neuro-acupuncture, typically the patient is not going to be healed in one visit. So the typical course of treatment is 10 visits, and each visit is about 45 to 50 minutes. Also is discussed what the scalp acupuncture entails. Typically the needles are in place for 20 to 30 minutes, and microcurrent is used to stimulate those needles. And that would be the course of treatments.
Wonderful, thank you. Dr. Kornfeld, What would you say is a key difference about your examination process that sets you apart from others?
I think a key exam finding that we're looking for that is very revealing for a lot of patients is how they're perceiving gravity. And that's an interesting concept that not a lot of people look for or talk about. I think it's because we all are perceiving gravity 24/7. And because we all do that, it loses its novelty. And we kind of forget about that. But there's actually a force that's weighing down on us 24/7 that our body and our brain specifically has to be able to perceive and interpret, whether that's consciously or subconsciously, most oftentimes subconsciously. So with us, a lot of the tests that we do are looking to measure or quantify how the patient is perceiving gravity. So one test in particular that we do is we do a Maddox rod test where we have this device. It's a piece of plastic, honestly, and you hold it up to the patient's eye. You shine some light in their eye as well, and we're able to detect the torsion of the patient's eyes. So your poles, your north pole and your south pole of your eye should be straight up and down when your head is leveled straight up and down as well, right? So your eyes should be like this. But as you rotate or tilt your head one way, your eyes should counter roll the other way to be able to accommodate for your head moving. So what we find a lot with that Maddox rod test that we use is that the patient's poles of their eyes are actually torted one way or the other, even though their head is neutral. So that's telling us that their brain is perceiving their head as being rotated or tilted one way versus the other, even though their head is actually in a neutral position. And that miscommunication there tells us that they're perceiving gravity as, or in other words, their subjective visual vertical is off, their vector is off. So they might be perceiving gravity as here being straight up and down. Sometimes we've had patients that have had to lay down all the way on their side because that's how off their brain is perceiving gravity as being straight up and down as well. So when we point that out to patients, that's a huge deal for them. It's very revealing. And that's a fundamental system that we have. So when we enlighten patients about that and the importance of that, that's huge for them. On top of that, that's going to impact your depth perception, for example. So we may do a finger, nose, finger test where they have to touch, my finger, then their nose back and forth, and they'll have to do it with their eyes closed. And they might, get 80% missing, or, in other words, 20% correct with their eyes closed. But then we put their head in what they're perceiving as that straight up and down, and you'll see their finger, nose, finger test actually correct just by doing that head tilt. And that is kind of the cherry on top with a lot of patients. And that's their aha moment where they really know. First off, they feel really validated with everything because a lot of them have been told that it's in their head and there's nothing really going on. But second off, that's when we know that we have a really, really good chance of being able to help them by just recalibrating these sensory systems as a result of that test as well.
Thank you for that explanation. Dr. Ballin, can you please share what is the importance of involving other figures that are in the patient's life when it comes to recovering from a brain injury? I know we see patients all the time who have support systems or may not have support systems, as in, teachers, parents, spouses, etc. What is the importance on those figures in patients' lives?
I think it's really important to have a support system, and it can feel very lonely when you're going through something like this. Typically, our advice to the support system is just to have a lot of patience, understanding. Often people, when they lose the ability to care for themselves and they're somewhat dependent on other people, even if it's just for driving, really start to feel like a burden. And I think it's really important for the support people in their lives to really make it clear that they aren't a burden. People do tend to isolate, which I often advise people to try and find a balance between letting people get the rest that they need to heal, but also not letting them isolate. So if they don't have the motivation, still making sure like they get out of the house, get fresh air, do certain things. Often I tell people that progress can be slow. It's not unusual for people to look better before they feel better. So often we see relatives that will say, oh, my son or my spouse, they've been smiling more, or we played Monopoly the other night and they haven't wanted to play a game, in 6 months, and little things like that. So we tell people, trust the people around you. I think as far as teachers go, just really making accommodations and not punishing people for having an injury. As far as we've applied, I help kids get, extensions in school, or if it's withdrawing from a semester for medical leave, things like that.
Yeah, absolutely. I definitely agree. Dr. Pollack, I just wanted to lastly ask you, for someone who hasn't experienced acupuncture before and may not understand what the feeling of it could be, could you describe a little bit about how does it feel when you are going through neuroacupuncture?
Well, first of all, it is a needle that's penetrating the skin. So typically patients will feel like a little pinprick, but after the needle is inserted, it should feel comfortable to them. So often patients describe it as a painless procedure, but they do feel it. And they typically are pleasantly surprised, first of all, that it doesn't cause pain. And second of all, after the needles are inserted, they feel very relaxed. And then also can feel energized after the treatment. And of course, typically within 1 to 2 visits, there should be a reduction in pain and other symptoms, as well as nausea. So typically patients are pleasantly surprised. Often patients ask, well, what are the side effects? And that's the beneficial thing about acupuncture, is that there is no side effects, as opposed to taking medication or other types of treatments. Another question that's asked, how does it work? That's a question with body acupuncture. And one is how it works is it helps to reduce inflammation. It releases endorphins, natural pain blockers, and increases blood flow, which helps injuries to heal faster. With the neuroacupuncture, it's been found that it can increase neuroplasticity. It can help the brain to rewire. And also sometimes the neurons have not died, so it helps to reawaken those neurons.
Wonderful. Thank you for that explanation. Well, I want to thank Dr. Kornfeld, Dr. Pollack, and Dr. Ballin for sitting down with me today. If you or your loved ones have suffered in the past or are currently suffering from a concussion, please consult with a medical professional. If you're interested in meeting with any of the panelists regarding your specific health, please see the description below with all of their information. Lastly, if you have any questions about your brain health, give Plasticity Centers a call at 720-551-8515 or visit plasticitycenters.com for a free 30-minute consultation. Thank you very much for attending, and we hope you learned something valuable today. Thank you.